Okay, welcome everyone. This is Dr. Coles. I am here today. We are having our monthly health and wellness event. I
Mhm.
have my guest with me who I will introduce in a moment. Our topic today, we're having an open forum discussion, maintaining your mental health during the pandemic. So, as we know, it's been so much topics, discussions, just a lot of coverage with the pandemic, and some people are way over it, and some people are not. So, we just wanted to kind of lend the opportunity for those who maybe wanted to just participate in an open forum, opposed to just constantly being educated about COVID and all the different changes, allowing everyone to have a platform that if they just want to listen to others participate in an open forum discussion, it may be beneficial to them. Who knows? I know it'll be beneficial to me. I usually have a takeaway or a walk away when we have these type of discussions. So I have with me Arnelda Monroe-Butler. She's a licensed clinical social worker for 14 years. She has experience within the behavioral health field. She's also the founder of Monroe Clinical Counseling Services, LLC. Monroe Clinical Counseling is a Black owned business that provides individuals, adults 18 and older, and couples counseling. Monroe Clinical Counseling also seeks to educate and empower the African American community on the importance of sustaining health, wellness, while eradicating cultural bias and stigmas that marginalizes and isolates individuals suffering in silence with mental health issues. As a therapist, she specializes in working with adults who experience or have histories of depression, anxiety, anger, stress, interpersonal relationships, grief, loss, parenting issues, couples issues, life transitions, and women's issues. She is highly skilled in assessing and implementing evidence based practices, such as, but not limited to, cognitive behavioral therapy, motivational interviewing, and brain spotting. So, if you or someone you know would like more information on Ms. Butler Monroe, her information will be located within the chat. And we will also make sure we mention her information at the end for everyone to know. However, her number is 610-922-1477. So we would like to welcome back again and thank you so much for coming and giving your expert opinion and advice and education on these topics. But everyone, please welcome Arnelda Monroe-Butler.
Thank you, Dr. Coles, for having me. Thank you so much.
Thanks for coming back.
Thanks. I love these forums. I really do. I love to be a part of
Yes.
them. Mm-hmm.
Yes. So
Yeah.
I just want to get started because, again, as I mentioned, and we were so honored to have Arnelda Monroe-Butler at last year. It was actually before the pandemic even started. She
Mm-hmm.
came out and she did an awesome presentation on mental health, just mental
Oh,
health.
thank you.
And as we know, mental health, that umbrella is so broad and so big. We actually had three separate speakers speak about three separate topics to do with mental health. And it was so enriching. Everyone was asking for your information, asked if we could have a part two and so forth. And that was before the pandemic. So can you imagine? That was like last year, January. So I'm glad that you can join us then.
Wow.
Yes.
Yeah, it was. Yeah, it was.
Yes.
Wow.
Yeah. So
Wow.
I just want
Mm-hmm.
to ask you a question for you before we put a question out on the floor for those who would
Mm-hmm.
like to participate. You as a clinical therapist, in your practice, in your profession, in your experience, what changes have you seen over the past year and a half since the pandemic?
Wow. Most of the changes, I would say the most significant change that I've seen over the last year and a half was a lot of individuals experiencing isolation, experiencing the after effects of losing someone to COVID, changes in everyday lifestyle to when a lot of people were social, um, working every day around other individuals, family members. Their lives were just so full and they had a routine. And then after the pandemic, when things were shut down. Now we're not mobile. We are confined to our homes. Jobs have changed. People have lost jobs. Significant changes in everyday lives. I saw a increase in need for mental health counseling for depression, for anxiety, people who felt as though they never had mental health issues were seeking out therapy. Most importantly, those who had mental health issues, who may have had some sort of treatment or were just trying to manage it on their own, found that they started to experience intensified feelings of depression, anxiety, due to the pandemic. So I found an influx in individuals, adults seeking therapy. And most importantly, I'm going to tell you the most important thing I found was that most of the people that sought my services were African Americans. And that said a lot. That said a lot, where again, mental illness and therapy is still a stigma in our communities. And a lot of people do not access services, whether they know someone who has mental health issues or they suffer with mental health issues themselves. I saw a significant change in people stating that I need help. I need help through this. This is something that I've never experienced before. Then again, on top of that, individuals who suffer with various mood and behavioral issues, this intensified um, their level of what they can handle. So it was very interesting to see that level of change, and it was very rewarding to be able to be there in the midst of that and assist and support men and women through that, through such a significant, through such unprecedented change that we experienced.
Thank you. That's really significant. That's a lot
Yeah.
of different things that you're helping people through. So how has that affected you personally? Because you're a therapist, you're the one on the other side, you're helping all these
Yeah.
people through all those multiple things that you just mentioned and named. How has that affected you helping others get through not only their normal issues, but now having that influx now that we've
Wow.
had that pandemic? How has that affected you?
Wow. That's the first time I really heard that question. How did that affect you being a provider, and how did it affect you being on the other side? I did not realize how much I was impacted until I would say around December of last year. I realized that I came to a point of burnout because I was allowing myself to be emotionally available to others who
Mhm.
needed me, but in turn, I was not really tapping into my self-care needs. I was not tapping into when I needed to take a step back for myself and process what was going on for me, what was going on in my personal life, and what was going on around me in the world. I was helping others process. I was helping others uh, through their stages, and I did not really acknowledge. I did not acknowledge where I was. It did not affect my ability to do my work. It just put me in a position of saying, I can't be 100% for my family, for myself, if I can't acknowledge where I am, if I can't acknowledge my feelings, if I can't acknowledge when I need to take a step back and process my emotions and process how this affects me as well. Because when you are a therapist, you are carrying, you are, you know, a catalyst of trying to help other people. And that's a lot of responsibility. You're coming with your clinical experience, you're coming with your skill set, you're coming with knowledge, you're, bringing to the table so many different things, but yet you have to process the stories. You have to process the hardship, the hurt, the pain, the grief, the trauma people are unpacking. And it's so important as, therapists to be mindful that we are human too. And to be mindful that, when others are unpacking, to sometimes take a step back for yourself and say, you know what? I need to breathe. You know, I need to process my own feelings. I need to process what's going on around me. I need to acknowledge who I am and where I am and my process as well, and be true to and talk about that and talk through that as well. And and I came to that point. I came to that point of, going through those stages of recognizing, understanding, talking through, and really being able to implement the idea of self-care. That's so important as a therapist because we do so much. And then we have to tend to our personal lives. We have to attend to attend to so many different roles in our lives. Um, so that's one of the things as well that I learned through this. The importance of not only talking about self-care, but doing it and knowing how important it is, how important it was for me as well, as I had to learn, understand how this was impacting me on the other side as a therapist.
Wow.
Yeah.
That's amazing. That's
Mhm.
amazing. But I'm so glad that you were able to recognize the importance of self care. Even though
Yeah,
you got to that point of burnout, I'm just so glad that you were able to hopefully start the process of recovering and healing and
of
so forth.
course.
So
Yeah.
that's just amazing. Thanks for sharing that. But I just want to put this question out to the floor. So for those of
Hmm.
you who are participating, feel free to jump in. But in what ways do you feel the pandemic has affected you? And that would be mentally, behaviorally, and emotionally. If anyone would like to, speak, just unmute yourself and you can join in. But I will say for me, the pandemic, it was one of those things that I don't even think I really took the time to really process because I felt like I was in maybe like the survival mode. Like, I don't
Yeah.
know what this is. I just know, I'm gonna keep my family safe. I gotta do what I have to do professionally, as
Hmm.
a nurse. And, I know I'm essential personnel, so I have to be prepared to jump in there, even if I don't feel comfortable, but I'm not gonna show it. But I just
Yeah.
have to protect myself as much as possible. So my mind was on all those other things. And I really didn't even get a chance to process how it has even affected me. I
Yeah.
think when I really first started kind of slowing down and just like, okay, my regular routine hasn't changed because even when we had mandatory stay at home orders, I was still going to work.
Yeah.
So, my
At
husband
first
and
it
I are
Sunday.
both my husband and I are both essential personnel. So even his
Hmm.
job, our worlds didn't change when it came to that. So
Yeah.
just trying to keep a sense of normalcy at home. We didn't know how long it was going to take. So I was more concerned about my children's mental health. My mom, she had to abruptly stop work, and I was concerned about her mental health. With now them having to be, like you mentioned, isolated and so forth. It's a new norm for them. I'm still getting that interaction going out there, little bit of social norm for me, even though it was still scary because at that point things were just happening and we didn't know how, why, how it would spread. One day we're hearing this, next thing
Hmm.
we're hearing that. So my world, I'm just like, long as my kids are good, happy, safe, and when I'm not working, I'll try and maintain a sense of normalcy at home. We'll just
Yeah.
spend more time together. I'll have my mom over here. We'll have family nights instead of once a week or once every 2 weeks. It's just going to have to be more often, so it's
Hmm.
kind of like putting my thoughts and stuff on the back burner, just making sure they were good. But
Yeah.
once I started seeing some of my close family members or friends who had COVID and who either, passed away from complications of it or from COVID itself, or who ended up having long lasting effects from it and so forth, then it kind of hit me and I kind of slowed down and I was able to kind of process this thing and how, I, I kind of can cope with
Hmm.
the sense of just a mass amount of loss, a
Yeah.
mass amount of illness, way more than I was used to all at once, because now it's not hitting the people you care for in the hospital setting. Now it's hitting
Yeah.
people everywhere around you,
Hmm. Yeah.
so it's just, so I would say mentally and emotionally, it took a while for me to process it. But I do think that, I was just, you're in that fight flight mode, and it's like you just do what you got to do until you take a second
Absolutely.
to process it. So,
Absolutely.
yes, yes, we
I
do
agree
have a
with that.
comment. Yes. So focused on maintaining the day to day. Thanks, Cheryl. So it's just,
Yeah.
yeah, you don't realize until it hits home or hits you personally sometimes. And that's kind of where
Absolutely.
it came with me. But I would say my family was pretty much good. But my son, he was the first one to get COVID. And that was like back in September. And I was just like, oh my God, what does this mean? Because at that time, we hadn't heard a lot of information about
Hmm.
teens and kids
Yeah.
getting it and what effects they could have.
Hmm.
So thank God he skated through it. And then more recently, my daughter and my husband, just had it. So, it's just
Hmm.
one of those things. It's like, you know what, we still maintaining and we're
Yeah.
still trying to cope, and we're
Yeah.
still trying to keep that sense of normal, because we
Yeah.
can't fully, just go 100 like back to normal. We still have to remind our teens and our family members to, kind of use those precautions, because it's still real and it's still
Yeah.
out there and it's still affecting
Yeah.
people.
Absolutely.
So, that's how it affected me.
I can so relate to the survival mode. Everything and everyone else was priority. Um, and that's why it hit me later. The first thing for me was the change in, when everything shut down for me, survival was, how will my children adjust? How will this affect them? Because everything just happened so quickly. And my daughter at the time, it was her last year in eighth grade. My son was doing so many things. Then we started hearing cases close to home, friends, people being exposed. Knock on wood, thank goodness we didn't lose anyone to COVID. And my prayers and condolences goes out to families and friends and people who did lose a loved one. But my instinct was, how is this going to affect the children? Are they scared? What's going on? And then I noticed a change in their behavior. My daughter, she was in bed most of the time and maybe on her phone. And then my little one, like their whole mood changed. So I was scared that, oh my gosh, are they at risk for depression? So, like you, I tried to normalize certain things in the household the best I could. And then on top of that, I was still trying to maintain the health and well being of um, clients that I was seeing. And it was so hard. I felt like I
Mm.
was doing a juggling act. Are they okay? Then my clients gotta be there for them, gotta be there for the children. And there was no way, there was no way to find a sense of normalcy as much as I tried. I felt so helpless. I felt so vulnerable. And then on top of that, not really knowing in the beginning what this all meant, I tried to pick and choose what I was and what I, couldn't process at the time because again, I was in survival mode, trying to make sure that everything and everyone else around me was okay. My mom, you know, I couldn't see her as much, but I had to internalize that, she's safe. So survival mode, everything and everyone else was more important at the time. Trying to find a sense of normalcy, whatever that meant. Trying not to allow my children to, go into shells, things change, for my husband and his job, everything was changing around me so quickly, so quickly. And I think that's why, it was easy for me to put everything and everyone else before me and why it didn't hit me until like, a year later, whatever, because it was it was so much, and I didn't realize. I didn't
Yeah.
realize that, I was just internalizing instead of processing at the time, you know?
Yeah.
So yeah, it hit me. It
Yeah.
did. It
And
really did.
I know we're talking about ourselves as, wives, mothers,
Yeah. Mhm.
many of us have all different professions, but just thinking about as I see, certain leaders, like the impact that that has to have on them, because they're not only thinking about themselves, their well-being, their families, their personal
Yeah.
life, but when you're
Yeah.
a leader of an organization, or, how stressful is
Mhm.
this new norm, and trying to keep everybody safe and figure out what's the best thing to do. And
Yeah.
imagine that affecting your mental health, weighing on you, because as we all know, that's a huge and great responsibility, because it's not just
Mhm.
yourself and your family you're looking out for and making decisions for, but now you have a whole organization or company,
Yeah.
or or
Mhm.
church, or
Mhm.
a whole community that's
The
like on
people.
your shoulders, and they depend on you and they trust your judgment, and they hope that they're making the right decisions because they're following you. So that is like on a whole nother level of maintaining your mental health, because that's a great responsibility.
Yeah, it
And
is.
I mean, I
Yeah.
recognize it, it's a great responsibility. But I would just put another question out on the floor. um do you find yourselves being more intentional since we've had this pandemic? So, do you find yourselves
Mm.
being more intentional, whether it's with your personal life, but what are some things that have come out of going through this past year? Do you find your thought process just being more intentional, or the things you do being more intentional, now that we have seen some things and been through some things? And I'll start off and I'll just
Mm.
say, when I mean intentional, I have completely viewed a lot of things like a 180 turn. Like, I have
Yeah.
really, I'm like, my focus have been
Mhm.
on the wrong things all this time.
All
Like,
this
this is a
time.
this is a
Yep.
horrible life lesson to learn, because it's at the expense of many people's lives.
Yeah.
And I should know that. I have a very my personal life story. I had suffered a lot of loss of my father, my sister, my brother, at a very young age, both sets of grandparents. However, when it's up in your face and you losing people left and right and you have no
Yeah.
control, these are people that were healthy one day, you saw them one day, and they gone that night. It ain't even here today, gone tomorrow. COVID had it like here today, gone today. You're
Yeah.
like, what in the world happened? I was
Yeah.
just with that person yesterday. Or,
Yeah.
they're finding people in their
Mhm.
apartments and the homes. And
Yeah.
like, when I tell you, it was like something clicked. And I just said, you know what? We're doing it all wrong. Like,
Yeah.
we literally have to live each day as if it's our last. And all of those things that were
Yeah.
more important, we put on the back burner. And, just other things that I know personally I, had going on. I really had to reevaluate some things and say, what is this thing all about? Let's sit down, let's talk about this. And my husband and I, like, I would self-reflect, but then I would sit down with my husband and talk to him.
Yeah.
Then I pull the kids in and we have a table round. We talk about some things to get it out there, because it's like, okay, when you get to the bottom of it, to the core of it, at the end of the day, is what's more important? You know, um, your livelihood, just doing things to be doing them, or actually living on purpose with intentions
Yeah.
of whatever your goal or vision is for yourself. It's like, when
Absolutely.
I'm out for keep putting my wants, needs, helping people. There's people out there suffering. Let's hit the boots. Let's hit the ground, running. Let's be boots on the ground. Let's help these people and stop putting things off. Like, we have, you know, um, people losing jobs left and right. How can we help those people? They're suffering. We have certain things that we keep putting off here in our home and within our personal life. Okay, how can we take that next step and just make sure we start moving forward with some of
Yeah.
those things? Because as we see, life is so short, and something can just wipe through the world, not just our community, but the whole entire world, and wipe out 500,000 people.
Yeah.
That's crazy. We've never seen
Mm-hmm.
anything like that in our, generation. So it's
Mm-hmm.
crazy to actually live it. It's like, whoa, it's a wake
Yeah.
up call.
Yeah.
So, that's just some of the examples of how we've really, I know within my household, we have really set some goals. I mean, we done vision boards. We really done sat down and really accomplished some things during this pandemic. I mean, I've heard of
Yeah.
other people, they've birthed so many creative ideas, businesses,
Yeah.
nonprofits, or just service things, to help people in the communities. Some of these things have been birthed out of this horrible pandemic. So
Yeah. Yeah.
again, I don't know if anyone else have experienced that, but I know for
Definitely.
me, yes, that has definitely
Definitely.
come out of this.
Definitely. Since then, like you said, just living on purpose. This was such a wake up call, such a wake up call to know that every day I had my priorities. I thought my priorities was straight. I thought my priorities were together. And then after this, you know, even now, we're still in it. Even now, I had reprioritized my goals. And not only that, I sat down and I had a heart to heart with myself and what am I doing as well to be a reflection to my children and making sure that they are living on purpose every day, that they are pushing towards their goals no matter what. My daughter, she wants to do cosmetics. So we're doing an LLC for her. My son, he wants to now do things that make him happy. And before it was focus on school, do this, do that. My priorities, was his priorities. Now it's son, no, who are you? What do you want to do? What's going to, what do you want to pursue? What's making you happy? Okay, let's go for it. Because like you said, um, living on purpose and just living is two different
Two
things.
different things.
It's two different things.
Yeah.
And I realized that my children have, my husband have so much to give, so much life to give, and to live on purpose every day. What are we doing to manifest our goals, to manifest our dreams? We are going to travel when we get a chance. We are going to stop putting things on hold because, we have to do this, we have to do that. No, no. If it's in reason, let's do it. If you're going to talk about it, be about it. It just opened my eyes so much to what it means to just be living and to actually be living on purpose. What is your purpose? What are your goals? There's going to be challenges to, what you want to do, your future, to, what goals, what things you put out for yourself. Okay. And, go for it. Why not? What's the alternative? For you not going for yours? What's the alternative in living every day, doing your 9 to 5, having ideas of dreams, of businesses you want to start, of an LLC, of investing, of being an entrepreneur, if you're not going to do it? If this time has not taught us anything, now is the time to live on purpose. Now is the time to be about you. Put your vision. Don't talk about it. Put your vision into that pot and make it and boil it and manifest it with ideas, manifest it with steps to, pursue the things in life that not only make you happy, but those things that you aspire to, the goals, your dreams, whatever they may be. You know, um, Life is not promised whether we're in a pandemic or not. It's not promised tomorrow. So why make promises to yourself that you are not going to fulfill? They're just going to be thoughts. They're just going to be empty promises. They're not going to mean anything. And we deserve it. You deserve it. Whoever deserves it. You know, we all deserve to live our best lives. We all deserve to, live on purpose. And like you, Dr. Coles, I've
Yeah.
lost so many people in my life before the pandemic. And, uh, you know, last year has taught me so much. Last year, you know, when things started to hit me and when I came to a point of burnout, it was, what am I going to do?
Yeah.
You know, what am I going to do? Is this it? Is this it? No, this
Yeah.
can't be it. This
Yeah.
is not it. Not at all.
Yeah.
You know, so um, I so love the idea of a vision board. Uh, one of my young ladies was talking about a vision board, and she had it behind her when we was doing a session, and it was beautiful. She had Paris, she had languages on there, she had all these things that she wanted to do, and then she had a space with nothing in it. And I said, what was that? What's that space for? That blank space right there. And she said, that's for the uncertainty. That's for anything and everything else I want to do that I might not know yet. And that's going to fill that space. So, you
I
know, so
like
she
it.
was saying everything I want to do. My goal is it's unlimited. The possibility of what I can do is unlimited. This is just a
Awesome.
piece of my vision here, but then there's a space where I know I can do so much more and go a little bit further. I just don't know what
Yeah.
that is, but I'm leaving myself open to the opportunity to know that it's just so much more there beyond what my vision can probably take me or give me.
Yeah.
So it was just so awesome. But I've learned so much. And
Yeah.
right about now, I'm like, if I think about it, if it's an idea, let's do it. Why not? Why not?
Yeah.
Why not? You
Why
know,
not? Yeah.
why not? It's we can look at this time right now is freedom.
Yeah.
Freedom to explore unknowns, freedom to really take advantage of the things that we couldn't, wouldn't, or thought we couldn't do.
Yeah. Yeah. And it's amazing that you said that because I know and my family all know, I'm always going, 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 as far
Yeah.
as work and any ideas I have, I'm the type of person I'm just going to pursue it. That's just, I've always been like that. Ever
Yes, and
since I was little.
ever
Yeah.
since I
I've
met you.
always, yes, I've always been like that. However, just recognizing and realizing, giving yourself permission to, you don't have to rip and run, especially if it's not going to
Yeah.
serve you. Like, you get to a point in your life, you're like, wait a second, hold up, hold up. I'm killing myself to
Yeah.
support somebody else's goals and dreams, and I keep putting mine on the back burner. How backwards is that? Like,
I'm making
get to the
somebody
point,
else rich
yeah,
and I ain't
or
doing me,
yeah, and you're like, wait a
right?
second, hold up, wait a
I'm
minute.
punching the clock
It's
for
like
somebody else.
I get it,
Yes.
but at some point you have to put yourself first, and it's okay.
Yeah.
You don't have to
Mm-hmm.
apologize for it. You give yourself permission, even
Yeah.
if you got to slow down. You give yourself permission to slow down. It's okay. You can rest and
Mm-hmm.
relax when you don't feel like ripping and running or or doing a bunch of things that's mentally exhausting. It's
Yeah.
okay. It's okay.
Yeah.
Give yourself permission.
Mm-hmm.
It's all right. So it's just you get to that point, and as again, as we mentioned, you see people suffering, losing their lives due to something that they had no control
Control over.
over.
Yeah.
And it's like, this is crazy. What am I doing? Like, we all know what's life if you don't live it. But if that
Mm-hmm.
didn't put it right in your face, like, yo, like anything like this could happen again. Or, this
Yeah.
is just a quick reminder to show you just how you could be just snuffed out. Like, you could do all the
Mm-hmm.
things you feel like you need to do to stay here on this earth longer. You can be a
Yeah.
vegan, you can exercise, you can whatever. COVID ain't care about that.
Mm-hmm.
Be a healthy
Mm-hmm.
vegan dead.
Opening. You're
You know what I
absolutely right.
mean?
COVID
So
don't
that,
care.
yeah. So COVID
Mm-hmm.
didn't care about that. So if
Mm-hmm.
you realize, it's like, I really, it was a great reflective time period. I know for me, I
Yeah.
know some people really, some people it is a struggle to be told you can't go nowhere, mandatory stay at home orders, and you're like, oh,
Yeah.
this is crazy, because they might be used to doing certain things, and that's helping keep their mind away from other things.
Mm-hmm.
But it
Mm-hmm.
really forced people to kind of, you know in whatever way that they had to cope with it. But a lot of people really had to be forced to kind of deal with themselves,
Yeah.
emotionally, mentally,
Yeah.
spiritually,
Mm-hmm.
physically. to even have, you know, even if those conversations were within themselves, a lot of people were
Mm-hmm.
kind of forced to kind of face themselves in a way that maybe they've never ever
And to
had to
face
face
themselves
themselves
before.
before.
Yeah.
Yeah, and it wasn't
Yeah.
all pretty for everyone. So,
Mm-hmm.
I'm just curious, has anyone had a similar experience?
I believe that can y'all hear me?
Yep.
Yes. Mm-hmm.
That through this time period, like y'all said, it forced you to reflect and to refocus and to get some things like to reprioritize, like you're saying. One of the things that really in my life that I began to really focus hard on was my health, and
Mm-hmm.
really, just positioning myself to be, more healthy, and do some things that uh, would make my immune system stronger. And because while we was at work, we had to keep working. I worked for, I'm a contractor for the hospital, and we was in it. It was crazy. I walked into the office one day and people was like walking away from me. Like,
Wow.
yeah, they was like, oh man, oh. I was like, man, listen, we had a few people that didn't want to work in the hospital,
Oh,
what I mean?
wow.
And I'm a PM, so I just run in and out, to make sure they're
Mhm.
good, but they work, what I mean? And
Yeah.
so it was challenging, not only to keep people's morale lifted,
Mhm.
what I'm saying, and even with the church to keep people strong in the faith,
Mhm.
um, and not, be consumed with fear,
Yeah.
as much as we needed to be concerned about the situation. We didn't want people, to lose hope,
Mhm.
become
Yeah.
depressed, what I'm
Mhm.
saying, and
Mm-hmm.
and become, to the point where they're afraid of everything, what I mean?
Yeah.
So that was really trying to keep people's hope lifted, Then we had to transition to, the online ministry, which was totally different, not only, having a few people in the church, and we used to congregating and fellowshipping, what I'm saying, but God was faithful, but it was an adjustment that we had to make. Um, and whether we liked it or not, it was important and relevant to do so. You know what I mean? And that's
Yeah.
where my heart was, and is now. And it's not so much about what I like. It This is relevant. We
Yeah.
really have to function in what's relevant. You know what I mean? When it comes down to our family, like y'all was saying, you could be gone tomorrow. We need to make
Mm-hmm.
sure that loving each other is a
Yeah.
priority,
Yeah.
and spending time together is a priority. You know what I mean? We'll get in an argument and that'll consume us for a while. You know what I mean? We don't
Mhm.
have time for that.
Nope.
You need to forgive and keep moving,
Yeah.
because you never know what's gonna happen tomorrow. You
Yep.
know what I'm saying?
Mm-hmm.
Man, listen,
Yeah.
y'all need to sit down and talk. Come on, let's get this over with. You know what I mean? Figure out what happened. Let's get it right so we don't do it no more. But
Yep.
Yeah.
nevertheless, time is not promised, man. And we don't
Yeah.
got time to be sitting around struggling with what you did and what you didn't do, what you
Yeah.
should have did. And nah, let's get
Mm-hmm.
ourselves together and and stay focused, man, because you never know what can happen tomorrow. I mean, that's
Yeah.
real for us. In
Yeah.
this season, this age, you wear the old folks say tomorrow's not promised. Well, we just
Mm-hmm.
seen something slide through
Mhm.
that made it real.
Yeah.
Tomorrow's not promised. You know what I mean? And
Absolutely.
anything can
Mm-hmm.
happen. And it's, that's just one thing that's wiping people out. You got murder rates going up. You got
Yeah.
all
Mm.
kinds of stuff going
Yep.
on. You know what I mean? People getting addicted to
Absolutely.
drugs, and people losing their
Yeah.
marriages because
Mm-hmm.
they locked up in the house, and
Yeah.
then you got the
Mm-hmm.
political thing going on. So it was just so much at one time.
One time.
Yeah.
And
Yep.
if you don't, develop a focus, you will be consumed with everything. That makes sense.
Yeah.
You really
Mm-hmm.
have to narrow your focus and say, nah, this is where you're right there. Because there is some advantages in the moment that you have to take advantage of.
Yeah.
You can't let
Absolutely.
those slide by. Like Joseph was saying, there's people who came up with some great ideas, and
Mhm.
people are prospering in the moment. And now let's focus on the good stuff, come on, that we can
Yeah.
get a hold of and ride through this thing until,
Right.
you know, that gets under control. So
Mm.
you come out of the storm with some good
Yeah.
stuff, and it's not all bad, negative, you know what I'm saying? You know, so, and you had some people pass away. I mean, we had like,
Yeah.
I had my grandfather pass away. I had, you know, my
Mm.
wife, grandma passed away. Her uncle
Mm.
passed away.
Mm.
You know, we
Mm.
had a teenager, young boy at the church pass
Yeah.
away. I'm
Oh.
like, yo, we done had
Mm.
a lot of, you know,
Mm.
a lot of loss in the last few months,
Yeah.
but we
Mm-hmm.
still got to stay focused. In the middle of all of that, we get an opportunity to purchase another daycare. You know what I'm
Mm.
saying? So
Wow.
you can't be
Yeah.
so caught up in
All the bad.
because
Wonderful.
you'll miss some of the good stuff that's going on. You know what I'm saying?
Yeah.
In the middle of all that, it's okay, there's the building we can get a hold of. There's an opportunity here. And if you're
Mm-hmm.
so consumed, you'll miss it.
You'll
You know,
miss
the
it.
location is great, the situation is great. All right, let's focus. You know what I mean? Let's
Focus.
keep moving. You know what I mean? Even at work, I couldn't believe how, you know, busy we stayed. Like, I mean, we busy. It's crazy. Like this was the last week was the first week where people they didn't have some spots. I mean, you got guys working overtime. And I'm like,
Mm. That's wonderful.
are we serious? People sitting home right now.
Uh-huh.
Yeah.
Unemployment's high right
Unemployed.
now.
Yeah.
And we're
What's
sitting
going
around
on?
cooking.
Yeah.
Yeah, I got
Yeah.
overtime hours. Like I'm eating. You
Mm-hmm.
know what I mean? Like,
Mm-hmm.
but like I
Yeah.
said, man, it's just such a roller coaster. And if you
Yes.
don't, you
Mm.
know, if you don't have a strong focus, man, you be all over the place. You
Yeah.
know, so. But
Mm-hmm.
yeah, man, I just believe having a strong focus on what
Excuse
you want to accomplish will get you through this moment. You know
me.
what I'm
Yeah.
saying? Like Paul said, he said, listen, I gotta forget those things that are behind me, reach for those things that are before me, and press toward the mark of
Absolutely.
the high calling that's in Christ Jesus. That's that you have to have. Like they talk about football, like a quarterback throws an interception. But guess what? He's still the quarterback for the next play. He
Mm-hmm.
can't worry about what he just messed up because the next play could be a touchdown, right?
Mm.
Yeah.
You can't be so caught up in what you just did that you miss a moment to do something better. You know what I mean?
Mm-hmm.
And
Yeah.
so you have your memory has to be, you know, to the point where okay, that's not the priority. Let's keep moving to where I'm going. I know this just happened, and I'm gonna decompress a little bit, but
Yeah.
I gotta keep moving, man. Can't lose your momentum.
Mm-hmm.
You know what I'm
Mm-hmm.
saying? And taking care of yourself, investing in yourself. That's so important.
Yeah.
So
Yeah.
important.
Yeah,
Good
it is.
workout. You know what I'm saying? Get up on that treadmill for a few minutes. You know what I mean? Just make sure you know, just doing something to make sure you are taking care of yourself,
Yeah.
appreciating yourself. You know what I mean? Pat
Yes.
yourself on the back a little bit. You know what I mean? Just, you know, go get a massage or something. Just to say, hey, let me take a moment and,
Mm.
you know, appreciate me for a second. You know what I'm saying?
Absolutely.
You
Yeah.
have to.
Yeah.
If you don't, you know,
Yeah.
you'll be drowning in all
Yeah.
kinds of stuff going on.
Yeah. Yeah.
It's enough stuff to worry about. You can pick what you want to worry about. You know what I
Mm-hmm.
mean?
Yeah.
Mm-hmm.
You just need to literally say, oh, this is what I'm going to think about, and I'm going to
Yeah.
focus on that.
Yeah.
Yeah, you know. So that's where I mean, just trying to keep people encouraged. I'm
Yeah.
watching people, you know, go through loss and go through
Mm-hmm.
challenging situations, and you know they're struggling. You know what I'm
Yeah.
saying? They, you know, they grieving or they this, that, and the other.
Mm-hmm.
On top of all this other stuff,
Yeah.
you know what I'm saying?
Mm-hmm.
It's
Mm-hmm.
something that we have to be encouraged. You got to stay lifted up. You got to stay encouraged. I'm looking at y'all in the field and y'all dealing with people on a day-to-day basis. You can't afford to go to work, you know what I'm saying, with a, you know, with bad stuff at home on your back. You got to go and face this ready to serve and be able to give it 100%.
Yeah.
And that's how it is. You on call 24/7. So
Mm.
that's the attitude of a pastor. You on call for 24/7. You know
Yeah.
what I mean? Any
Yeah.
phone call could be the phone call that's going to change the rest of your day, whether you like it or not.
Mm-hmm.
You know what I'm saying?
Yeah.
Mhm.
But so you
Yeah.
just got to be prepared for those moments, man.
That's true.
That's where I'm at. Just being
That's so
focused on what
true.
I need to do to make sure that I'm geared up, prepared, ready to go, do what I need to do, stay focused, take care of business, and love my family, man. You got to love your family. I don't care how much they get on your nerves.
I know that's right.
Listen, you need to love them, man. Listen, I'm going to appreciate you getting on my nerves. I'd rather you be here getting on my nerves than not be here. You hear what I'm saying? But that's critical, man.
Yeah, it's so interesting. You said that appreciation outside of everything else, just appreciating, really, really appreciating what you have. And another thing that hit me was, wow, how much did I take for granted? You know, being home with my family every day during a lockdown. At first it was tough. Woo! At first it was tough. You understand me? Two teenagers, my middle child, you know, my husband already worked from home, but even still, I didn't. I did work from home, but I still had to go see patients in the community. And when all of that came to a stop, and when you're all together and your daily life changed and you're face to face with everybody, it was tough, right? However, I walked away and I still feel so much gratitude, so much appreciation. And that was something I really, really self-reflected on, as far as how much do I take for granted every day, you know, because I have a healthy family, you know, thank God, because, you know, my kids, when they leave, they're coming back. I didn't lose them, you know, to the pandemic, or my husband, or my mother. And, you know, when we were in close quarters with each other, right? And I wasn't going to work. My husband wasn't going to work. There was no more school. Everything was virtual. That was a whole situation within itself. It was coming to the point of learning these people in this tight environment. Where you going to go? There's no school. There's no, you know, there's no going to work. There's no, you know, going to the movies. There's no going out. Close quarters every day. And some days it was like, you know, but then as time went on, and, you know, when you hear the stories and when you hear about just the tragedy around you and the loss around you, it shouldn't take that for you to say, I'm blessed. It shouldn't take that for you to be, you know, for you to appreciate what you have, you know. But unfortunately, that was my reality in the moment. Like, oh my gosh, I need to appreciate what I have. I need to appreciate my kids being here. Yes, they're getting on my nerves because there's nowhere for them to go. So now they, you know, they cranky. So, you know, now they want to make everyone else cranky, and, you know, just going through, you know, all the stages that we had to go through in that time. And then after it, I said, thank you, you know, thank you for that. Thank you for that time. Thank you for, you know, putting us in such a small space, not, you know, saying thank you for what was going on, but thank you that I had that opportunity, that I still have that opportunity. You know, thank you for what I have. Thank you. Thank you. You know, just the appreciation of that, and, you know, just feeling guilty that I wasn't acknowledging how I should have appreciated what I had before, you know? When, you know, tragedies around you, and people are talking about the loved ones that, you know, they lost, taking a step back, like, oh my gosh, oh my God, I was complaining about this, us doing this, you know, getting on you about it. And the small things no longer matter. They still don't, you know, but so much more appreciation, so much more gratitude, and purposely saying, I love you, purposely saying, I love you, has become so important. I even took that for granted. They know I love them. They know. The kids
Yeah.
know. No, it's so different now.
Mm,
When you purposely tell them, I love you, and they looking at you like, okay, something wrong with you, mama? Yeah,
mhm, mhm,
because I need you to know. I'm intentionally wanting you to know. When I hang up with the phone, when I hang up on the phone with my mom, when I leave my mom now, intentionally, I love you. Instead of saying bye or goodbye, it's I love you. That's how we end when we depart. So important. That was one of the greatest takeaways from this as well, during this time. Just
mm,
appreciating, just being thankful, just being so much more intentional, present. That's another thing. Just present, you know, put my work stuff sometimes first, this first, that first, and forgetting that the important people, the important things in my life are right here, right? And I should be intentional in my time and my effort with them. Not to say that I wasn't before, but being more intentional to fill in those gaps and making sure that their needs, whatever, needs to happen for them is coming first. Not to say that it wasn't before, but being more intentional and making sure that nothing falls through the cracks. Just everything. It changed my mindset on that as well. You know, being more intentional, being more present, and being more appreciative in regards to, the love I have around me and my family.
That's awesome.
Yeah.
That's awesome. Well, before we wrap up, I just actually have two questions for Pastor. So you had mentioned the importance of self-care and self-love. And
Mhm.
also you had mentioned more appreciation for your family and how, the pandemic has destroyed certain families, messed up relationships and stuff. So I had two
Mhm.
questions. One of them is, you as a pastor, have you seen an increase in the opposite taking place, meaning reconciliation? So maybe families joining and bonding together, or marriages actually reconciling due to realizing that they're taking it for granted, or life is short, or let's work this
Mhm.
thing out. And then
Mhm.
also, how do you maintain your personal self-care as a leader? So you work
Mm.
and you're a leader.
Yeah.
So how do you maintain your self-care? So I was just
So
curious.
for the first question, I have seen people, you know, align themselves up with, being unified through this. That makes sense.
Mm-hmm.
And probably more or less caring for each other. And like you said, they probably getting on each other's nerves, but they're coming together and they, standing strong. You have some people that's going to be challenged, what I mean, because now work was the getaway.
Yeah.
See what I'm saying?
Yeah.
For the kids, school was the getaway. They going out with their friends was the getaway. I mean, there's no getaway now. So whatever problems were there, right, it forces you to be able to deal with them and find a way to deal with them. What I mean? Find a way to, you got to find solutions now because there's nowhere to go, right?
Mm-hmm.
And then it's good because in their mind they make up their mind, we're not going nowhere, so let's make the best of it. Let's get it right. Let's fix it because we're not going nowhere. That
Mm-hmm.
makes sense. So when
Yeah.
you see that, that's workable. We can work on
Yeah.
that. If you get the other thing, the I'm out of here. Now that's a whole nother ball game, right? So you've got that, and especially with people, losing loved ones and seeing, people, going up out of here at a massive rate, people concerned, what I mean? And, they want to make sure that everybody's safe, so there's another level of care and
Mm-hmm.
concern being demonstrated that wasn't there before. Like she was saying, your kids looking at you like you crazy, like something wrong. You know what I mean? Like, nah, I'm concerned. I want to make sure you come back in here safe and healthy, right? And so you've got that. And then, as far as myself, I really believe uh now this is what's crazy, right? I've been, you know, dealing with a lot of stuff going on and a lot of stuff, but devotions have kept me, really, seeking God in the midst of it, really, having a good book to listen to or whatever, sitting down with my wife and relaxing. We ain't doing nothing. Oh, you know what? This is what you're ready to do. We going away this weekend. Well, I wasn't planned. Well, we just planned it.
I like that.
It's getting a little tight up in here, right?
I like
you know
that
what I mean?
too. Yeah.
Getting a little tight up in here. Let's go. Where we going? The beach. Well, it's gonna rain. I don't care. We just need the room next to the ocean. I don't care if it's raining outside. Listen, we gonna go lay up in the bed and watch Netflix or something. I don't know what we gonna do. What's the plan? Nothing. Nothing's the plan.
Yeah.
We gonna spend some time together. We gonna go get something to eat. You know what I'm saying? Listen, we gonna listen. I don't care if we gotta get taken care. You know what I mean? I don't care. Listen, we get up out of here. It's gonna cost this. Listen, spend the money. You know what I'm saying? You're gonna spend money taking care of yourself, or you're gonna spend some money on some therapy. One or the other. Which one you
exactly. I love it. I love it. I'm actually that one.
I'm being honest with you. I told her, I said, listen, every 3 to 4 months, we out. We
you
out.
have to.
Listen. So you either plan it, listen, you either plan it or listen, or
that's my motto. That is my motto. Yes, quarterly, I gotta go somewhere, and that's for my mental health.
I like that.
For my mental health, I need to go sit somewhere and unwind and not worry about nothing.
Be lost.
What are you doing on that phone? If you ain't playing a game, put it down. You know what I'm saying?
You absolutely.
You gotta worry about those kids. They'll be all right. By the time it's only 2 days. You know what I mean? They'll be all right.
But for
real though, man. You gotta unwind, man. They'll be all right. Listen, let's go. I need it. You know what I'm saying? Especially dealing with everything that and that's just, listen, we work hard, right?
Yeah.
We need to spend some time enjoying ourselves. And getting to a place where we can relax, because so much is on our shoulders. You know what I mean? Our decisions matter. Like our decisions cost, right? It's either going to be a profitable decision or it's going to cost something, right? And so it's a lot riding on our shoulders. So every once in a while, you got to back up, look at life from a restful place and not a busy one. And then make some good decisions out of that. Right. This is where I want to go. Let me back up. I'm taking a couple blows. Let me go to the corner over here and relax for a second, get some fresh air. You know what I'm saying? But yeah, man, that's that's been some of the things that we've been doing, man. As soon as, I said, listen, man, we're gonna wear our masks, we're gonna stay 6 feet. And we listen, we gotta go. I can't do it. You know what I'm saying?
Yeah. I like that.
You gotta take care of yourself, man.
Yeah. Absolutely.
And be honest with you. One thing I've learned is to be honest with myself. And I can look my wife in the face and say, oh, this is too much. I need, you know what I mean? I not only look my wife in the face, my prayer sounds like that. All right, God, listen. This is too much. And he strengthens me. You know what I'm saying? He gives you no more than what you can bear. And then there's a strengthening that takes place. Why? Because I'm honest. Here's another one. I don't like what's going on. I really don't like what's going on. That's part of my prayer. I don't like this. You gotta help me because I don't like it. And it's hard to be effective when you don't like some stuff. Right? You gotta make some good decisions, even though you don't like some stuff. You know what I mean? I don't even like the decision I got to make, but guess what? It's the best decision. And over time, it'd probably be better off than what I would want to do. Right. So you just you got to be honest with yourself, and you got to sit back and say, this is what I need to do and run with it.
That's
Okay.
awesome. Thank you so much for sharing that. So,
Thank you,
guys, we
Pastor.
are actually going to end on this note, but I will tell you that for the rest of the year, we will continue to have our health and wellness events. Again, they have been great. Even when people are not on real time, they're uploaded on YouTube. So we have been getting great views. However, just some topics that's to come, just to kind of let you guys know that health and wellness encompasses so much.
Yeah, it
We have
does.
some topics that comes to women's roles and as it relates to stepping into that next phase in our lives as women and how our roles end up defining us as women. But do we really want that to happen? Do we want to also be defined by who we are and do we know who we are? So that's going to be another great open panel discussion that we're going to have. And then also, I'm going to definitely have my pastor back on and we'll have some deep conversations as it even speaks to our mental health, our wellness overall when it comes to our spirituality and how that
Yeah.
plays a part in it as well. So we will
Mhm.
definitely have him back on. I know man, we'll probably have to talk about that for like 2 hours. What you need, Pastor? Like 2-3 hours.
Nah,
I
man,
know
listen.
he gonna be on that, and he gives some good nuggets. So anybody watching that's definitely gonna have a pen and paper and take some good notes because he gives some
Yeah.
good nuggets. And yes,
Mhm.
I am bragging because that's my pastor. Okay. So we are done for today. Thank you all for joining. You guys
Good
have a
seeing you,
great,
Pastor.
safe
Good
rest
God
of
seeing
your
you.
bless you, family.
weekend.
Keep
Thank
up
you,
that good
Dr.
work.
Coles. Beautiful. Thank you.
Yes, you're welcome.